Most people who suffer from shoulder pain are doing the one thing that keeps it from healing. They stretch it. And stretching feels logical. It feels productive. It feels like you're doing something. But depending on what's actually wrong inside that shoulder, stretching the wrong structure can set you back weeks. The problem is, shoulder pain is not one condition. It's a category. And inside that category are several completely different problems that look identical from the outside but respond to entirely opposite treatments. That's why the same YouTube routine helps one person and wrecks another. Before you touch another stretch, you need to know exactly what type of shoulder you're dealing with. So here's what we're going to do. 3 tests. Right now. You can do them sitting or standing wherever you are. Each one reveals something specific about what's happening inside that joint. After that, I'll walk you through exactly which exercises match your result. Pay attention to 2 things during every test: where the pain is and whether it feels painful, weak, or both. That distinction tells us more than most people realize. Let's start with the first one. Hold your arm relaxed by your side. Let it just hang there with no tension. Now slowly raise it straight out to the side, palm facing down. Move slowly. There's no hurry. In the beginning, you should feel nothing. No pain, no discomfort, just your arm rising. But somewhere in the middle of that arc, somewhere between roughly 60 and 120 degrees, you might feel it. A pinch, a catch, sometimes a sharp ache that makes you want to stop. If that happened, stay with it. Keep lifting past that spot. Keep going, and watch what happens to the pain. In most cases, it fades. You go through the painful zone, and then out the other side, the shoulder calms down again. Pain, then no pain. That is the pattern we're looking for. This is called the painful arc, and it tells us something very precise. Between your arm bone and the bony shelf above it, there is a narrow gap. When the arm passes through that middle range of elevation, the soft structures inside that gap get compressed. That's the pinch you felt. And you've been feeling it in daily life without knowing what it was. Reaching overhead for a cabinet, pulling your arm through a jacket sleeve, buckling your seatbelt, lifting a bag off the counter. Every one of those movements passes through that same zone. Now you know why they hurt. If this was your test, the exercises for it are coming, but go through all 3 tests first. It is very common to have more than one pattern active at the same time. For the second test, hold your arm straight out in front of you and angle it slightly to the side, halfway between directly forward and directly sideways. Now, rotate your thumb downward like you're pouring the last drop out of a can. That's your position. Hold it there. If someone is nearby, ask them to press gently down on your wrist while you resist. If you're alone, use your opposite hand to push down lightly. Now resist that pressure. Try to hold the arm steady. If that causes pain at the top or front of your shoulder, that's one signal. If the arm just feels weak, like it can barely hold against even gentle pressure, that's another. Either one counts as a positive result. What this test targets is one specific muscle in the rotator cuff, the supraspinatus. It sits on top of the shoulder blade and it does the heavy work every single time you initiate lifting your arm. When it's irritated or weakened, a very specific set of daily activities becomes difficult. Reaching up for a high shelf, putting dishes away, washing your hair, pulling a shirt over your head. People think the whole shoulder is gone. It's usually this one muscle. It's almost always this one muscle. Move to the third test now. Bend your elbow to 90 degrees and hold it pressed against your side. Keep it tucked there. Now try to rotate the forearm outward, away from your body, against a wall or door frame. Press the back of your wrist into the surface and push as if you're trying to turn the arm open. Hold that for a moment. If this causes pain on the outside or back of the shoulder, note that. If it feels noticeably weaker than the other side, note that too. This test checks the external rotators, a group of muscles that tend to get systematically neglected. Steering a car, pulling a heavy door, reaching back for a seatbelt, turning a key. These are the movements that strain them. And because almost everything in daily life pulls the shoulder inward, the outward rotators are usually the weakest link by the time pain shows up. If more than one test created pain, that is completely normal. You don't need a perfect diagnosis from this. Just ask yourself which test felt most like the pain you experience every day in real life. That is the one to prioritize first. Here is what we're going to do next. Exercises for each test, in order. When we get to yours, focus. But watch all 3 sections even if only one test was positive. The exercises for the other patterns often prevent the next problem before it begins. The first exercise requires no equipment and no effort from the shoulder itself. That's intentional. Find something sturdy at roughly waist height, a table, the back of a solid chair, a countertop. Place the hand of your healthy arm on it and lean forward just slightly. Let the sore arm hang completely straight down. Don't grip anything, don't hold tension in it. Let gravity have it. Imagine it as a rope attached to the shoulder. Just wait, nothing more. Now begin very small movements. Swing the arm gently forward and back. Small, slow, lazy swings. Not pendulum style where momentum takes over. Just easy movement, barely moving. Do this for about 30 seconds. Then switch to side. Same quality, small and slow. 30 seconds. Then small circles, clockwise, imagining you're drawing a circle the size of a dinner plate on the floor. 30 seconds. Then reverse direction. 30 seconds the other way. The whole sequence is about 2 minutes. Here's what it's doing. When the arm hangs with gravity pulling it down, the ball of the joint is gently drawn away from the roof above it. That gap where the pinch happens gets opened up slightly, and because you're not fighting gravity, the irritated structures get a break. They aren't being compressed. They aren't being asked to work. They're just floating in a slightly decompressed space. The mistake most people make is going too big. If the swing gets large, the shoulder muscles kick in to control the movement, and the whole benefit disappears. Keep it small and deliberate. Also, make sure the support arm is on something that won't move. A wobbly chair changes the mechanic completely. If this movement already feels better than trying to lift the arm, that's a meaningful signal. It means the joint responds well to being opened up rather than compressed. Remember that feeling. It's information. The second exercise keeps the arm supported so the painful structures don't have to carry the weight. Sit at a table. Put a small towel or cloth on the surface, something with a bit of slide to it. Place the forearm of the affected side flat on the towel, palm down, elbow pulled in close to your body. Now slowly slide the towel forward across the table. Let the arm glide straight out in front of you. When you reach the first hint of resistance or discomfort in the shoulder, stop right there. Hold it for 1 second, then slide back to the start. That's a single repetition. Do 8 to 10 of these, moving slowly, breathing out as you slide forward, breathing in as you come back. What the table is doing is taking the weight of the arm completely off the structures inside the shoulder. The joint doesn't have to support anything. The irritated tissue gets to move through a gentle range without being loaded. This is how you start rebuilding range of motion safely. Not by forcing, not by pain pushing, by borrowing the table's support. The single most common mistake is going too far. People assume more range equals faster recovery. It doesn't. If you slide past the first hint of discomfort chasing more stretch, you re-irritate the exact structures you're trying to calm. Think of each rep as asking the shoulder for permission. You go to the edge of what it offers and you stop there. Also keep your back straight throughout. Don't rock the torso forward to manufacture extra range. The movement has to come from the shoulder. If it comes from the whole body leaning, you're not training what needs to be trained. The third exercise looks almost too simple. That's exactly why most people skip it, and it's exactly why their shoulder takes twice as long to recover. Sit tall in a chair with feet flat on the floor, arms hanging relaxed at your sides. Now gently pull the shoulder blades toward each other and slightly downward. Not a shrug, not an arch. A small, deliberate squeeze toward the spine and down, as if you were trying to tuck them into your back pockets. Hold that for 5 seconds. Release slowly, 8 to 10 repetitions. The effort should live between the shoulder blades in the middle of the upper back, not in the neck, not in the arms. If the neck tightens, ease off. Here's why this matters so much. The shoulder blade is the foundation the whole arm moves from. When it sits properly and moves well, the roof of the shoulder joint lifts slightly and the pinch zone opens up. When it doesn't, all the other exercises only do half their job. Many people find that their side lift test starts improving within 1 to 2 weeks of this exercise alone, because you're fixing the foundation, not just chasing the symptom. Do all 3 of these once or twice per day. In the first week, mild soreness after the session is normal. It means the muscles are being asked to work in ways they haven't for a while. Sharp pain during any movement is not normal. If it's sharp, reduce the range, reduce the effort, and try again the next day. Now, for the supraspinatus. If your empty can test was positive, this muscle is either inflamed or weakened or both. The approach here is specific. You don't push harder. You load it carefully and let it rebuild over time. Stand facing a wall, about 1 step away. Place both forearms flat against the surface at roughly shoulder height. Elbows bent, palms and forearms in full contact with the wall. This is your starting position. Now slowly slide both arms up the wall together. Keep the forearms touching the entire way. Go as high as you can while maintaining that contact. When the forearms start to peel off the wall, you've reached your limit for today. Slide back down to start. That's 1 rep. 8 to 10 of these, slow and controlled, exhaling on the way up, inhaling on the way down. 2 things to protect against. First, forearms lifting off the wall. If that happens, you've gone too high. Come back down. Second, the lower back arching as the arms rise. That's the body compensating because the shoulder can't actually reach there yet. Keep the core lightly engaged and the rib cage down. Work within what the shoulder can do honestly. If this is pain-free from the very first rep, that's a good sign. The muscle can tolerate this much load and you're ready for the next step. If there's mild discomfort near the top, simply don't go that high. Find the range that feels like work without feeling like damage and train there. The next exercise begins real strengthening, but it does so without any joint movement at all. Stand with the sore shoulder facing a wall. Bend the elbow to 90 degrees and tuck it firmly against your side, forearm pointing straight forward. Now press the outside of the elbow into the wall as if trying to lift the arm out to the side. The wall won't let it move. That's the point. The muscle fires completely. The joint goes nowhere. Hold that press for 8 to 10 seconds. Start at 30% of your maximum effort. Not half, not full. 30. Rest. Repeat 5 times. The progression is the critical part. After 3 to 5 days at 30%, if there is no increase in pain, move to 50%. After another week, 60. That is as high as you need to go in the early phase. The instinct is always to push harder and faster. With this muscle, patience is the actual technique. Most people who have tried to strengthen the shoulder and kept flaring it up made exactly one mistake. Too much load, too soon. For the external rotators, the approach follows the same logic. Mobility first, then strength. Don't reverse that order. Hold a stick with both hands in front of you. A cane, a broom handle, any light rod. Both elbows bent to 90 degrees and tucked against your sides. Now use the healthy arm to push the stick across your body so the affected forearm rotates outward, away from the stomach. The elbow on the sore side stays pinned against your body the whole time. Only the forearm moves. Go as far as comfortable. Stop before any sharp resistance. Return to center slowly, 8 to 10 reps. The good arm does the guiding. The sore side is being moved, not forcing itself. Do not let the elbow drift away from the body. If it does, you've gone too far. Do not twist the trunk to create extra range. Keep the movement small and clean and honest. Now for the strength component. Stand with the sore shoulder toward a wall. Elbow bent 90 degrees and pressed firmly against your side. Forearm pointing forward. Press the back of the wrist into the wall as if trying to rotate the forearm outward. The wall stops it. Hold for 8 to 10 seconds. 30% effort. 5 reps. Same progression as before. 3 to 5 days at 30%. Then 50, then 60. Same rule applies. Never sharp pain, never maximum load. There is one final thing worth saying clearly. These tests and exercises are designed for common mechanical shoulder problems. There are situations where they are not enough and where waiting is the wrong choice. If your pain started after a fall or direct injury and has not improved after a few days, get it looked at. If the shoulder feels unstable, like the joint might shift or give way, don't keep exercising it. If you are waking up at night with pain that no position relieves, that pattern needs a clinical eye. If the weakness is getting worse week over week rather than better, that is different from normal recovery. And if you have been doing the right exercises consistently for 3 to 4 weeks and nothing has shifted, that is a signal to get imaging done. A tear or a structural issue needs different management than mechanical pain. For your first 7 days, keep it simple. If the painful arc test was your main finding, do the 3 exercises for that pattern once daily. Don't add anything else yet. If the empty can was your result, do the wall slide and the isometric press every day, starting at 30%. If the outward rotation test was the one, begin with the assisted rotation and follow it with the isometric. Don't skip the mobility portion. If 2 or 3 tests were positive, start with the pattern that matches your daily pain the most. Give it 1 full week. Then come back and retest yourself. If that movement feels even slightly easier, even if it's far from perfect, that is real progress. If nothing has changed, slow everything down and check your form. The most common reason these exercises stall is pushing into sharp pain and calling it discomfort. The shoulder is not a mysterious structure. It follows rules. Load it correctly and it responds. Load it wrong and it digs in. Now you know which type you're dealing with. That changes everything.